There's a higher chance of you having a stroke.
You may remember a story I did on adult snoring and sleep apnea and the concerning effects it can have on your heart. Well, that story stuck with me because at the time, my 8-month-old had all the classic signs of sleep apnea. When I told the doctor, he advised I get her checked out immediately, and that's exactly what I did.
I came to you with my daughter who had those symptoms. She was not breathing during the night. She would stop breathing. And then we did a sleep study that said she was only getting 80% of her oxygen. How common is this?
It's actually very common. So about 1 to 5% of the kids we think have obstructive sleep apnea. And that's actually, where your story ended up is your daughter, we needed to do a sleep study because when they're young, we want to make sure that these symptoms are affecting her during her sleep.
The result? My daughter Remington needed to have her tonsils and adenoids removed. Dr. Ryan Borak is one of the specialists in the Ear, Nose, and Throat Division of Children's Hospital in Philadelphia. And thank goodness he was there to talk me through it.
Our tonsils and adenoids we are born with, and they are part of our immune system. Importantly, their main job is to sort of be a traffic stop of things coming in and out of the nose and mouth. So when we're born, they're relatively small, but as we grow through infancy, toddler, and then adolescence, they kind of grow with us. And in some kids, they grow really large. It's the second most common procedure that we do in kids. The numbers, it's around 300,000 ambulatory procedures for tonsillectomies. And if you include tonsillectomy and adenoidectomy, it's almost 500,000 a year throughout the US that this happens.
Remy's tonsils and adenoids were so large they forced her to breathe through her mouth during the day and not sleep at all at night. But there was something else. During the day, Remy seemed to have problems concentrating.
The long-term effects of sleep apnea are studied really well in adults. And we know that this lack of oxygen and sort of this sleep fragmentation, this constant waking up at night because they're not breathing very well, can actually lead to hypertension and strokes and heart attacks. We think that this is actually happening in kids as well, that along with, not getting enough oxygen, their sleep fragmentation, that they're seeing these high levels of inflammation. And we can see severe cases with pulmonary hypertension, cardiovascular disease, along with even behavioral changes. Just the brain isn't able to rest at night, and so we're not getting that recovery period. And so we can see cognitive and memory disorders as well.
And get this, studies show there may also be a link between sleep disorders and ADHD in children.
It's not always sleep apnea, however. And so a tonsillectomy isn't quite as simple. Sometimes with ADHD, you can see insomnia. You can see restless leg syndrome. You can see something we call periodic leg movement syndrome. And you can see sleep apnea. So it's good to have a discussion of sleep symptoms in kids that have ADHD to say, are we showing signs of obstruction?
Thankfully for us, the tonsillectomy and adenoidectomy did the trick. Remy is now back to being a normal kid, whatever that means.
Hi, I'm Shirley.
And I'm Regina Mitchell. For more videos like this, subscribe to WHYY.